interest in cervical cancer and human papillomaviruses. Other heads of department, dignitaries, colleagues, students, members of the press, good morning. Today is 3rd of March. It's not actually 4th of March, which is globally earmarked as the International Papillomavirus Awareness Day. But we decided to bring it to Friday because tomorrow is Saturday, and bringing people out from their homes to come and join such a presentation might not be as easy if we look at the ease with which we can come together on a Friday. So that is the reason why we are having the event today. But internationally, it's going to be 4th of March, which is tomorrow, Saturday. The Papillomavirus Society of Gombe, Nigeria, which is a relatively new group, registered just last year in November, in collaboration with the prominent institutions in Gombe, the Federal Teaching Hospital and the Gombe State University, tries to organize this event largely to join the rest of the world in raising awareness on human papillomavirus and the associated diseases, mainly the malignancies, and is actually something that globally is being encouraged, and we hope, as the chairman has said, all of us will be advocates of HPV prevention through vaccination, especially, and also cervical cancer prevention through screening. The topic is HPV vaccination and screening for prevention of cervical cancer in Nigeria. Just trying to say, in a way, we could equally have made it to be HPV prevention and screening for cervical cancer elimination. But we feel, yes, the world is talking about elimination, but we are still battling with introducing many things. So we feel prevention is still what we might be talking about now. But the whole world is talking about elimination. But we know the problems we have in underdeveloped or low-income countries, low-middle-income countries. So the story is about HPV and cervical cancer. And we know cervical cancer, as popular as it is now, is still killing a lot of women, even though it is preventable and curable, but if detected early. And so if we're able to handle the virus at the early stage through immunization and also through screening, detecting the virus at an appropriate age, then we are likely going to eliminate this cervical cancer worldwide. So in 2017, the International Papillomavirus Society approved the 4th of March as a day set aside for the creation of awareness worldwide on human papillomavirus and all its associated malignancies. And that's why it is regarded as International HPV Awareness Day, which is IHAD for short. And after the meeting in Cape Town, it was subsequently also introduced in 2018. And so since 2018, the 4th of March annually is being celebrated as the International Human Papillomavirus Awareness Day, with different groups that are interested in preventing the spread of the virus and also the effect of all its associated diseases come together. So this is just a brief introduction on this, and to also let us know that since 2018, there have been quite a number of things that have been used for each year, some of them extending beyond just 1 year. And the one we have this year is one less worry. One less worry. The interpretation is such that we have many things that worry mankind and are problems to humanity generally. And so cervical cancer, HPV associated, is something that can easily be eliminated, eradicated, and we have one less worry to contend with. So we have relatively no other issue to do with that if we are able to eliminate cervical cancer. So that's just the interpretation. And as we know, HPV is not just restricted to cervical cancer in terms of etiology. HPV actually causes 5% of all cancers worldwide, and that's why the virus is actually very important. As we can see, we have many other malignancies that are associated with human papillomavirus, penile cancer, anal cancer, vulva, vaginal, oropharyngeal, and others, as we can see. So these are just few slides that we made as Papillomavirus Society, Gombe Nigeria, to create this awareness. We try to translate, even though it's a bit difficult sometimes translating English into Hausa directly, but just to create that awareness. As I have earlier said, it was in November 2022 that the Corporate Affairs Commission registered this, and we tried to tap from the widespread expertise that we have around in Gombe, so that we'll use that opportunity to raise awareness and also really come together to fight this menace. And what it means is we need all specialties in the healthcare industry, and we need everybody from all parts or walks of life, so that these aspects that might not necessarily be medical, so to say, will have also other people that are taking care of them. We need more people in the community, we need more people among patients, we need more people that are interested from the government and the general public. So the story of human papillomavirus and cervical cancer. This is something that, several centuries ago, over a century ago, the observation initially was that nuns and prostitutes were compared, and it was observed that nuns generally, don't come down with cervical cancer when you compare them with prostitutes. And that was the beginning of the consideration of cervical cancer as something that has some links with sex or sexual intercourse generally. And that pushed the scientific world to research, in mainly sexually transmitted infections, and naturally more viruses were considered. And initially attention was mainly on herpes simplex virus, but later it was actually understood that it was human papillomavirus. So the virus itself, papillomaviruses generally by 1936 they were discovered, and by 1956 the human papillomavirus was also discovered. And the main research that led to the understanding of human papillomavirus in relation to cervical cancer was around 1984. But you see some publications will be quoting 1983, some will be quoting 1984, but mostly 1984. After that, several works actually led to the discovery and final licensing of the human papillomavirus vaccines in 2007. Well, 2006, but by 2007, most countries in the world have actually licensed the vaccines, and it started with a few, and now we have about 3 or 4 of the cervical cancer, HPV vaccines generally. Cervical cancer is the 4th most common cancer among women globally, and about 342,000 deaths were recorded in the year 2020, most of which actually occurred in the low and middle income countries. And these are some of the reasons why we need to pay attention ourselves on this problem, because it affects us, disproportionately, in that we carry more of the burden compared to other parts of the world. So women living with HIV, well, not just HIV, but HIV increases the likelihood of progression to cervical cancer 6 times when you compare to people that are, or women that are not HIV positive. But there are several cofactors that together contributes and determine the progression of the infection, because almost all women will have the infection once they have become sexually active, but 90% within about 2 years or so will clear the virus if they are immunocompetent, and that makes it a bit more friendly. However, those infections that will be around the age of 30 and above are likely to progress, or are likely to persist and eventually progress to cervical cancer. And so we have many other cofactors, but HIV is considered very, very important because of the fact that these are a population that are a bit more vulnerable. So it's preventable and curable if detected early and treated, and is a disease of inequity of access, because we understand the variations in access and affordability of the vaccine and screening, especially in countries that are yet to make it a national policy and it has not been introduced. So there are a lot of control measures, from primary, secondary to tertiary preventive measures. And like we have earlier highlighted, the HPV is the most common sexually transmitted infection worldwide, and so virtually all women at a point in their life will have been infected with the virus. The same thing with men. More than 200 have been identified, and a number of them, like 40 to be precise, have been known to infect the cervix. Out of those that can infect the cervix, about 15 of them are regarded as high risk, and those are the ones that are responsible for cervical cancer. Out of the 15, 16 type 16 and 18 are responsible for almost 70% of the malignancy. And so HPV 16 and 18 is the main focus, even in the development of the vaccine. And that's why the first one, cervix, actually is for HPV 16, is HPV 16 and 18, even though we have a lot of cross protection. And so high-income countries have programs in place. I think we have highlighted this, and low-middle-income countries have limited access. We have also highlighted this. Nigeria has one of the highest HPV prevalent rates in the world. Of course, we have a lot of explanations. This is a prototype of the HPV, which is a virus that have different components, but just to highlight that, the E6 and E7 are the oncogenes that drive the development of malignancy. And this is to just summarize the pathogenesis. Usually small abrasions or cuts that happen in those areas, because it infects actually the basement membrane. So it allows the virus to gain access and infects at the basal layer, and that gives the chance for the virus to establish infection and subsequently multiply, and is being shed higher up in the epithelial strata, as we can see. This is again to summarize the pathway that follows after the infection. A number of women or a number of people will clear, and others will persist, and like we said, mainly depending on